Please join me in welcoming Robert Reich.
Thank you, and thank you all for coming tonight. When I first heard about the Center for Health Leadership, it seemed to me such a natural idea because not only do we need leadership with regard to health in this country, but also health and health care and the problems of public health and the way our system is organized, private health, for-profit health, have become front and center. And if you combine all of that, you naturally need a place where people can understand how to exercise leadership and influence the course of our history on this issue, which has not been easy. Number one, you do not have to have formal authority to be a leader. Many of you in this room are leaders. You may not know it, but you have exercised leadership and you probably could be even more effective exercising leadership. There are many people who have formal authority who are not leaders. There are many leaders who do not have formal authority. And it's very important that you distinguish between the two, because a lot of people think about leadership and they say to me, well, the real question is, how do I become a cabinet secretary? That's not the central leadership question you should be asking yourself. Number two, the central leadership question that you ought to be asking yourself is, how do I energize and mobilize people? How do I overcome the natural tendency we all have to avoid work? Does anybody in this room have any experience with work avoidance? We all spend a lot of our time and a lot of our energy avoiding the work that we need to do. And some of that work is work that we need to do for ourselves, but some of it's work that we need to do for our community, for our friends, for our partners, for people who are in our organization, for the university, for Berkeley, for anything. I mean, there's work that needs to be done if we're going to address problematic situations. And a true leader helps people overcome these work avoidance mechanisms. Now, what are the work avoidance mechanisms, the classic work avoidance mechanisms? There are 4 of them, and I've got to give them to you because this is all very relevant to healthcare. And I'll put it in the context of healthcare. The number 1 work avoidance mechanism, first on my list, is denial. And I'm not talking about a river in Egypt. Denial. It's not a problem. I mean, there is no global warming. There is not a healthcare problem at all. I mean, people can get healthcare. They can afford healthcare. People love healthcare. They're very happy with healthcare. A true leader helps a group of people understand that they cannot rely on denial any longer. The longer they deny, the worse the problem becomes. And a true leader uses every mechanism you can imagine to overcome denial. Examples and illustrations. With regard to healthcare, a true leader needs to, again, be very clear. We have a healthcare crisis. The crisis is not only a crisis of coverage, but it's also a crisis of expenditure. We're now spending 16% of our whole economy on healthcare, and we're not covering 45 million people who are here among us. And it's the most expensive system in the world on a per capita basis. But in terms of life expectancy, we rank 40th among nations. And infant mortality, we are terrible. And our system is broken, fundamentally broken. It is unbelievably costly. It is broken. We're the only system in the world, the only healthcare system in the world based upon avoiding sick people. The second work avoidance mechanism a true leader has got to overcome, if any work is going to be done, is escapism. What do I mean by escapism? Well, a lot of people say, yes, there is a problem. Yes, I understand there's a problem. There is global warming, climate change. I understand there is a healthcare problem, but it's not my problem. Part of escapism is also distraction. I'd like to work on that problem. It is a problem, but I really do want to watch the Super Bowl. Number 3, work avoidance mechanism, is scapegoating. Yes, I understand that there is a problem. Yes, I'm not going to escape from it. But you know something? The problem is because of them. And all we have to do is change them or extirpate them or get rid of them or somehow get them to behave differently, and the problem is over. And finally, the most insidious work avoidance mechanism of all, the one that I find the most troubling and frightening, is cynicism. I understand there's a problem. I'm not going to escape from it, and by the way, I'm not going to blame somebody for it, but nothing can be done. It's intractable. Nothing will ever happen. It is simply always going to be a problem. We're just going to have to live with it. I don't believe that we are capable of any change. A true leader has got to overcome cynicism. A true leader has to motivate people, not just through charismatic speeches, but also through showing dramatically that there are instances of progress. Look what this state has done with healthcare. Look what this state has done. Look at this experiment. Look at this pilot project. Look at this with this country. Look at this country. I mean, constantly pointing out that there are possibilities. This can work. A leader, most profoundly, is an educator. A leader, at the soul of a leader, is someone who can help a community recognize and solve its most intractable problems, can mobilize action. The history of our country is also a history of remarkable change. Nothing good happens in Washington unless people, good people, with the right ideas, among them many leaders, work these issues for years and years and years, and don't whine. Thank you very much.